people with a mental illness are twice as likely to have a substance use disorder compared to the general population. At least 40% of all addicts and alcoholics also have another mental illness such as depression or bipolar mood disorder. This phenomenon is called dual diagnosis. And to talk to us more, we're now joined on the line by expert addiction psychologist Kate Saxton, who is the group practice manager at Changes Addiction Rehab in Johannesburg, South Africa. Very good morning to you, Kate. Thank you for taking our call. What do we mean when we talk about dual diagnosis?
Good morning, yes. So dual diagnosis is basically when you present with both an addiction and an alternative mental health issue such as depression, ADHD, bipolar, or any other mood disorder, and they present at the same time.
Is it common, though?
It's very common. It's very unclear as to what starts first. Often what will happen is people will self-medicate with substances because of an underlying mood disorder or alternative mental health disorder. But also addiction, substances, etc., usage can trigger the underlying mental health issue as well. So it is very common.
Do we know some of the characteristics of people with dual diagnosis? I'm thinking they present multiple symptoms.
It's very difficult to say because there's no one way for anybody. You know, the sad reality is everybody presents in a slightly different way. The reality is what we'll often see is people start getting into a lot of trouble, family issues, family conflict, financial issues, aggression, suicidality, depression. All those things start presenting themselves, and along with the substance issues, disappearing, stealing, crime, those kind of things. They all happen in conjunction. And what we have seen with addiction is it might start slowly, but it gathers speed and momentum as it goes along. And the faster it goes, the more destructive it is to both families and society.
The most important question as well now, Kate, is it treatable?
It is treatable. It's manageable. It's a chronic disease, unfortunately. Addiction is a brain disease, so it is classified as a brain disease. But with the right treatment, with the right program, it can be managed as such. It is a behavioral disease as well, so it presents very much so in behaviorism and that kind of thing. So we work a behavioral program as well as treating it from a psychiatric perspective with the right medications, treating the right concurrent mental health issues. So if you work a good program, change lifestyle, that kind of thing, you have a better prognosis.
Now, if you to talk to me and I had a family member who was suffering from dual diagnosis, what advice would you give me on how to support this family member?
Okay. There are quite a few routes depending on what stage of the disease is, but absolutely the individual or the identified patient needs to get help. They need to find a facility that will treat the dual diagnosis. A facility, if you send somebody to a facility that doesn't have the right dual diagnosis support, the chances of relapse are incredibly high. But at the same time, whilst the individual patient is being treated, it's very important for the family to get help as well. So what I mean by that, they need to get educated. They need to start, joining different groups that support families of addiction. Because as we know, addiction is not an individual. It doesn't happen in isolation. It happens to the family. Because as the individual gets sicker, so does the family. Because their behaviors change to start enabling the addict. And the more we try and love them, the worse the disorder gets. So there are things like tough love that has to be instituted along with. And so both the whole family dynamic and the whole family system has to be supported through the program.
And it is a process there, Kate. Thank you so much for speaking to us this morning. That was expert addiction psychologist Kate Saxton, who is the group practice manager at Changes Addiction Rehab in Johannesburg, South